Yes, good try.
So welcome to our first Natural Science Seminar of 2019. Woof, woof, woof. And today we have a big treat. We have some former Spring Arbor students. Yes, they sat in those very chairs at one time.
They did, I remember.
Darn straight. And we had them in classes, and we were very proud to call them our students. So the first one I want to introduce is Miss Jamie Atala. Jamie graduated 2014. She always sat in front, and she always had something to say. And that was Jamie. And she went on from here to work for Scribe America. She has served in several different capacities in Scribe America, both as a scribe and as an administrator. She's now a hiring manager. And then someone who is not yet here, who will probably be here soon, is she was formerly Lydia Wise, now she's Lydia Eriks. She's also been with Scribe America 6.5 years. She's the regional manager of Scribe America. She also graduated in 2014. And then Chris Matthews is here. He graduated in 2018. He's already a big bad project manager with Scribe America, and he is in the process of putting his application together for medical school. So you're going to ask me for a letter of recommendation, aren't you? Yes. Because I'll write you a beauty. And then it's a real treat for me to have Sarah, not Lily Bowie anymore, Sarah Menke back. Sarah was also with Scribe America. Sarah graduated in 2013, and after that she went to physician assistants, did a physician assistant program. She graduated from that. She got married last year, and so congratulations, Sarah. And she is now at Sparrow in the emergency room, and she also did some work as an undergrad with head trauma. What's that place? It's called?
Origami.
Origami, yeah, the paper thing.
And he did write me a letter of recommendation.
Yeah.
He gave me for gay school.
Origami, and I met some people from Origami actually at your wedding, and they do a tremendous job with people who've had traumatic brain injuries, and I'm still predicting, I'm not a prophet or son of a prophet, but I'm still predicting Sarah will somehow end up with brain trauma somehow to her resume as she works as a clinician. So, well, okay, close enough. So today they're here to tell you about Scribe America. They're also here to tell you about healthcare in general, what scribes do, where healthcare is going. We have somebody, of course, who's right in the thick of it over here. But the motto, as you can see there, doctor saves lives, scribes save doctors. My own doctor, who works at Townsend Medical, he has nothing but good things to say about scribes. And Jamie has nothing but good things to say about Spring Arbor students who become scribes for the most part. So she is here to recruit you, yes, but even if you say, well, scribing is not for me, don't turn off, because you'll hear something here that may really click with you later on in life. So please welcome our former SEO alumni who represent Scribe America.
Thanks, guys. All right, so what we want to do today, I want to we're brought tons of Spring Arbor alum. Lydia will be here soon, which is really exciting, who are either still working for Scribe America or have worked for Scribe America and are now working professionals. So I want to take a little bit of time just to introduce ourselves, kind of tell you a little bit about our story and our background, kind of how we got where we are, go over a PowerPoint, scribing, what it is, what we do. I'm sure you've heard of it, but dive into it a little deeper. And then I want to give you guys time to just ask us questions of any curiosities you have, or if you resonate with any of our stories, or whatever it might be. So my name is Jamie. Like Dr. Baratovich said, I'm currently serving as the hiring manager for Scribe America. So what that means, I just signed that contract like a week or two ago, actually. So I am overseeing all the hiring associates across the Midwest at this point. So kind of a little bit about how I got there. I, like Dr. B said, sat in these seats freshman through senior year of my journey here at Spring Arbor. I was a double major in biology and Spanish. Graduated with both my majors, and then started with Scribe America the summer before my junior year of school. I started right here in Jackson, so I worked in the ER for about a year and a half, and then come my junior year of school, I got a little burned out, and I was like, you know, I don't know if I want to go to med school anymore, and I went to Dr. Newhouse's office, and any of you know who he is? Do you guys still know who Dr. Newhouse is? Okay, we're good. Okay.
He's teaching for us.
He is, again, okay, awesome. But yeah, I went to his office, and I'm like, this is a huge traumatic thing. Like, I don't want to go to med school. I wanted to be a doctor since I was like 6. I went to his office, I'm like, Dr. Newhouse, I don't want to go to med school. And he looks at me, he goes, okay.
That's too easy.
I know. So graduated with my big bad biology degree and was like, well, what do I do now? Because yeah, I don't know. I don't know what you do with a biology degree if you decide not to go to further education. So picked up full time with Scribe America. Oversaw the Family Med departments in Jackson for about a year and a half. Then I started overseeing all of the outpatient specialties we staffed in Jackson. So I'm not sure what the number is now. At the time, it was about 9 different specialties. So I got to kind of float around to the different specialties. That was really cool. Then I got transferred to Ann Arbor in 2017. I did a few implementations here and there. So I helped actually implement a lot of the clinics here in Jackson. So the endocrinology clinic that we staffed. I helped in the HEMOC department as well. I actually implemented a little clinic up in Mackinac City. Christopher's in Petoskey right now, so he knows the joys of living in northern Michigan in the winter, if any of you live in the north. Got transferred to Ann Arbor, started implementing a back and pain clinic, did urology. Then they brought me on as the hiring associate, so my main goal for that was recruiting. Found a lot of good challenges in that, a lot of joy, lots of fun stuff, really kind of grew into myself as a professional. Decided to start nursing school last semester. So I'm actually, I'll sign back in a minute. I'm actually currently in nursing school. Also just accepted a promotion, so that's exciting. So life's busy, but it's great. It's honestly really good in this job and this experience I've had with Scribe America over the last 6.5 years has made nursing school not difficult for me, which is great. A lot of what I learned here in undergrad as well has made that really great. Like a lot of stuff from all the classes from my science profs, I'm like, I remember things and this is awesome. Like it's so good having all this back knowledge. So yeah, that's where I am today. That's kind of how I got where I got. Sarah, do you want to go ahead and tell us a little bit about yourself?
So my name is Sarah, as you guys all know. I was here from 2010 to 2013 for my sophomore through senior year. Graduated with a biology health careers degree. I was homeschooled my whole life, so I actually got to graduate from high school early, so then I got to graduate from college early. So I decided to take a year off before I went to PA school. I figured why not get more experience, build up my resume, that kind of stuff. So that's when I worked for Scribe America for that year. Got a job in the ER back in Lansing at Sparrow. So I worked there for a year and then started PA school about a year later. So I did PA school for 2.5 years, graduated in 2017, and then started working at the end of 2017 in the emergency room. So in the emergency room, or the company that I work for, EPMG, they don't hire new grads. They go actually put them through a fellowship program. So I actually did a fellowship where they train me so essentially for a whole year. We start out where the whole year the attending has to see all of our patients. So we get trained, it's a teaching hospital, so we work with residents. We get trained in how to do procedures and like specifically for ER. So I now have an ER fellowship focus, and so I just started working now, not as a fellow, back in November. So for the past like 4.5 months on my own, and started working full-time nights.
Big bad
just this
PA.
month. Yeah, as a PA. So yeah, the Scribe, but the beauty for me was that I worked for Scribe America for a year in the ER that I ended up working in, and so I cannot describe to you like how much it has helped me. Even just starting out, I was ahead of the game because I knew exactly how to chart, I knew what I was looking for, I knew how to talk to doctors because I've just been doing it for so long. So it's really cool. So now I'm working and absolutely loving it and loving life. It's pretty great. So yeah, it's super cool.
So I'm sure some of you have let me see Christopher, because he just graduated last year. So
yeah, I'm Christopher. I was here from 2014 to 2018, so yeah, like I said, I'm freshly graduated. I did scribing all 4 years when I was here, so I started freshman year, which was a challenge, but something that's very achievable and very beneficial. So I worked in the emergency room in Jackson all 4 years, and then upon graduation, I got the promotion to the project manager position, which is in charge of implementations. I go all across Michigan. When a hospital wants to start a scribe program, they send me in, and I do all the recruiting, and I train the doctors how to use scribes, and I get locals to be scribes for them. So far I've done implementations in Alpena with an orthopedic surgeon group, and then Saginaw with some primary care doctors, and now I'm up in Petoskey, braving the harsh winter with an oncology group. So yeah, I get to see tons of different specialties, which is super beneficial when you're thinking about our future in medicine, because consider all those things.
And then our regional manager is back. If you want to come down and introduce yourself, tell us your story. Dr. B already gave a nice introduction to who you are.
Oh, thanks. So yes, my name is Lydia. Nice to meet you all. Jamie and I actually were in the same one with Sarah as well. We were in the same graduating class. So I started with Scribe America in 2012 as a scribe in the emergency department with Jamie, same place that Christopher worked as well. And once I graduated, I decided I wanted to take some gap years. I wasn't really sure where I was headed after that. And I started as a chief scribe, so I oversaw the local site that I was working at the time. And then I became a local project manager like Christopher is now, and I traveled around Michigan helping to start new sites. And then about a year after that, I became regional manager out in Cleveland. So I moved out there and oversaw all of the scribe contracts in the greater Cleveland area. About a year ago, they asked me if I would be interested in moving back to Michigan because there's a spot open. My husband is from the west side of the state. My family lives in northwest Ohio, so I was like, yes, I'd love to be closer to home, work with some of the providers that I helped implement and bring the scribe program to initially. So it's a little bit about my history. I think my path with Scribe America is very convoluted, maybe is a good word to use. But what I really enjoyed is all of the opportunities that they have offered me within medicine, whether it's gaining experience specifically looking towards going into PA school or med school and gaining all of that knowledge, or looking at a different aspect of healthcare, whether it's the health administration side, whether it's a different role beyond that as well. I know we have a few of us here today, and there's so many more alums that are working in the different areas and aspects of healthcare, and can all point to scribing as that foot in the door and understanding what is out there and where you best fit in the healthcare setting. So that's my little spiel. I'll give it back to you, Jamie.
Oh, I have paperwork for you.
Oh, okay. Awesome.
So, like Dr. B said, our motto, doctors save lives, scribes save doctors. Super corny, super cheesy, it's true, that's what we do. We really take away a lot of the electronic burden that the physicians have to do these days. And we kind of give them their lives back so they can in turn not worry about documentation, go home to their families. And at the end of the day, actually look their patients in the eye and treat their medical problems versus staring at a computer. So, the purpose of a scribe is to improve that patient-provider interaction. Again, allowing the provider to look at their patient without having the laptop in between. Does your physician actually use a scribe now?
Yeah.
He does?
Yeah. In
Nice.
fact, the Wall Street Journal ran an editorial that said, doctors, get your head out of the computer.
Yeah. So my personal physician that I use I'll be sitting on the patient bed, and every time he comes in, he'll sit down with his back to me at the computer, and he'll look over his shoulder and go, you know the drill, and he knows I'm in the scribing industry, and I'm like, I know the drill, and I always tell him, I'm like, I can help you, but it hasn't changed anything yet. But we have had providers who, once they get a scribe, they're so enthralled with it because they don't have to look at the computer, they can look their patients in the eyes. There was one provider I used to work with fairly frequently who, and this was very rude of him, but I still think it's funny. One of his patients decided they didn't want the scribe in the room, which is totally patient's rights, like I get it, you can do that. And so he took his laptop in the room and sat at the bedside with his laptop like this the entire time, with his face buried in the computer just to prove a point. I was like, that is not good. It's fine.
Is that Dr. Bigelow?
Yes. So from that point on,
Sounds like that.
yeah, I'm pretty sure that patient let me in the room. But the point being, we enhance their efficiency, we give them that personal interaction with the patient's bag. We're able to get things done in real time. A lot of people will ask, like, well, what's the difference if they, you know, they use the system where they can basically voice to text and they're talking and it's typing it all up, or they record it later and they send it to someone and someone does the dictations at home. We're getting it done in real time. So we're actually seeing the patients with these providers. By the time we leave the room, the chart is done. So all they have to do, they read it, they sign off on it, they say cool, maybe change a few things here or there, but they're still not taking the time afterwards to record something, to send something, waiting for the records to come back. It also makes it more accurate because we're, again, doing things in real time. So we're documenting events that are happening in front of our eyes versus at the end of the day, after we've always seen anywhere from like 15 to 80 patients, depending on the specialty you're in. There are clinics you see 80 patients in a 10-hour shift, and it's insane. So imagine going back at the end of the day and documenting on your 7:45 a.m. Like, something in your mind is going to get mixed up. Their quality of life is also greatly improved, and this is one of my favorite parts of the scribing world, is we get to effectively see that difference we make on providers. The project management role especially is great for that, and I know Christopher can attest to this, Lydia can attest to this, I can attest to this. Sorry, Sarah, you weren't a project manager, but
I can attest.
she can attest as a practicing PA.
Well, I just got a scribe for the first time this week, actually. I have 3 shifts with scribes because I'm working full-time nights, and I can attest as a provider, like, I cannot describe how much it helped.
Yeah.
Like, I can't, it was amazing.
But we'll have providers come up to us that say things like, I went to my daughter's dance recital for the first time ever, and her daughter's 14 and has been dancing for 6 years. We'll have providers that will come to clinic the next morning and they're like, I had dinner with my fiance and I didn't know what to do afterwards because I didn't have charting to do. Like, I guess we were like, let's go watch a movie. So it's cool. It's really powerful, really great stuff to see, knowing we are actually making a difference in sometimes what seems to be such a small role. So again, we work alongside them, write the notes in real time, do the patient encounter, act as a transcriptionist. Questions about this? I kind of already touched on it. Doing good? Okay. So, why is this a great experience for anyone looking to work in the healthcare sector? This is my favorite part. Everything you learn. Kind of already talked about this with all the introductions, but literally, you will learn so much. You will gain so much experience, so much knowledge, so much confidence in what you're learning, what your abilities are, and where your strengths and weaknesses lie. Yeah, nursing school is great because I don't have to, I mean, I work, don't get me wrong, it's not like I do nothing, but the experience I've gained from this job has been great in a multitude of ways. One, for all the medical knowledge you gain, the medical decision making you learn how to do, in the sense that you're not, for the first time, learning how to apply all of this knowledge you're learning in your 4 years here. And I think that's one of the hardest parts of going from undergrad to professional school to as a working professional. As an undergrad, you're learning all these fun facts. You're learning all these biological processes. You're learning these chemical processes. You're learning how everything works and functions, but you're not practically learning how to apply it to a clinical setting. So you're learning, if any of you had to memorize the electron transport chain yet, that's a really fun one. But you're not understanding how that works when it comes to drug interactions with the pathophys of the body. So becoming a scribe allows you to see how all of these things you're learning in your classes actually apply to essentially working as a professional in the medical field. A lot of people won't learn this practical knowledge until 3rd or 4th year of med school, if that's something you're aspiring to do. At least so far in my experience in nursing school, a lot of the pathophys is kind of brushed over. We really don't even dive deep into that. So it's really nice to have that extra layer of knowledge from my bachelor's and from my scribing experience in the 12+ specialties I've got to work in this time. When do you learn it in PA school? When do you learn second year of PA school?
You learn all
so-
the pathophys first year and then apply it second year.
Yeah, so there's a lot you absorb as a scribe without even realizing it. You'll start talking about things and you're like, I don't even know where I got this information, but it's back in my brain and I'm really confident about it and this is great. It's a great place to be too, especially if you don't know what you're doing. We don't have a glass ceiling, so it's easy to move up. If you're not sure of something, it's a great place to be because you gain professional experience as well. I actually really enjoy management. I actually really enjoy doing things like this. I actually really enjoy recruiting, which I never thought I would. And so it's been great to develop myself as a professional as well, but also be able to maintain a relationship with the medical field, if you will. So you get that direct patient exposure. You get to see tons of patients. I can't even tell you how many patients I've seen in these last 6.5 years without me being a certified medical professional. I've seen patients across 12 different specialties. I see how providers interact with these patients. I see how the nursing staff interacts with these patients. And again, I'm going to allude to nursing school a lot. Being in nursing school, that's made my life so much easier in my interactions with patients for the first time as I'm going into clinical. When we learned how to do a head-to-toe assessment last semester, I knew all of it already. I mean, I never actually listened through a stethoscope and so like, oh, those are actual heart tones I'm hearing, or oh, those are actual crackles or abnormal lung sounds I'm hearing, or okay, this is hyper versus hypoactive bowel sounds. Like I had never actually heard it, but knowing the terminology, knowing what it meant, and knowing how to apply it versus just kind of memorizing a script so I could pass my head-to-toe checkoff, it was very natural. I knew how to interact with my patients. It's little things that I still kind of miss here and there, like my hands are cold, so every time I palpate their abdomen, they flinch, and I still forget to warm them up. But you know, that's just a little thing. But overall, like I know what I'm looking for. I know what I'm doing because I've had so much exposure watching physical exams happen over and over and over again. So if any of you have gotten paid to shadow, let me know where you go to do that, because that doesn't happen. Which is basically what scribing is. It's a paid shadowing experience where you get a deeper depth into medicine. So you're not just shadowing though, you're not just a fly on the wall, you're actually a very integral part of the clinical team. And that's a very cool place to be, again, especially without having a certification or any prior knowledge or experience. One of my biggest frustrations, I remember when I would be applying for summer jobs, is you look for any sort of job in the medical field and they're like 2 to 3 years of experience. And I'm like, how can I get this experience? No one will give it to me. Yep, and that's one of the beautiful things about Scribe America is we're able to take people where they are and we can train you and we can shape you and help mold you into this beautiful scribe. And you get all these awesome experiences. So yeah, you literally get paid to shadow providers on a daily basis. But again, it's more than shadowing. You're an integral part of the team. A lot of times I actually are reminded of things by things that you say. Like I'll be like, hey, I turned up the blood pressure and it was kind of low today. And then they're like, oh, I should probably check that. And so it's good. They really, really rely on you. They rely on their scribes more than they rely on their residents. Just fun fact. So they really, really trust their scribes. And we do, not going to be humble about this, we do a great job training you. Like we are going to make sure you are prepared before you get onto the floor. So again, you get insight into that medical decision making, how to utilize support staff. So you don't just work with the providers, that is your main scope, but you see how they interact with the nurses, with the MAs, with the tech staff, with everyone. And you get that insight on how to interact with patients, how to talk to patients, when to keep your mouth shut, when you really need to use something called therapeutic communication, which I'm learning all about this semester. a lot of times I'll be standing in a room and I just get super frustrated, just like listening to someone talk sometimes. I'm not gonna lie. And I'll be standing there typing, I'm like, I'm so glad I'm not the doctor in this situation, and I'm just gonna take notes, and that's my job. So, you get great insight on how to do things we're not all always good at. Sarah, do you actually want to talk about this?
What,
Soap notes.
soap notes? Like, you mean the notes that we don't usually call them soap notes, so that's why I was, yeah. Like, so, as a practitioner, like,
You can stand up.
fine. So, as a practitioner, writing soap notes, I mean, there is no way around it. There are very, very, very few clinics that use paper charts nowadays. I mean,
So,
it's
sorry,
almost-
really quick. So SOAP notes are how we format our notes.
Oh, yeah, sorry.
Stands for Subjective Objective Assessment Plan.
Subjective is the story, objective is the physical exam finding, so it is literally what I am physically seeing or feeling. And then assessment is what I think is going on, my differential diagnoses, and then P is the plan, so what I'm gonna do about it. So then, yeah, so that is the basis of a note that we write as providers. So I have a little bit of limited experiences. I've only worked in the ER as a scribe and only worked in the ER as a PA. So I don't have a lot of extensive when it comes to outpatient, but in terms of soap notes here, soap notes in the ER, I mean, when you're coding somebody, you need to know exactly when you give the meds, you need to know exactly when this, and so as a scribe, it is so important that timeline, like you said, the real time. So that has been amazing. So the other thing that we do as scribes is, again, in the ER, EKGs from our perspective is one of the most important clinical decision-making things that we do. And we sit there and we document the EKGs. So the doctors dictate it to us, and we write it down. So again, incredibly important. This is a huge one for me. So watching physicians perform physical exams, sometimes doctors will, while they're in there doing physical exams, they'll say, I'm finding tenderness here, or I'm, positive this sign here, Murphy sign here, whatever. So you write these down, or you Google it if you don't know how to spell it. You write, yeah, all the time. Lots of Google because again, we don't have a lot of medical experience as scribes, generally speaking, so we don't necessarily know all of pathophys or all the spellings or medical terminology. So, so you write things down, and sometimes, especially the doctor has time, to say, well, what is that? And they'll explain it to you, which is awesome. So you get to learn that, but also you learn signs, you learn physical exam findings, you learn what sick looks like, and you learn what unsick looks like. Again, this is only from the ER perspective, but I can now walk into a room, first day of being a PA, I could walk into a room and say, that patient's sick, that patient's okay. Like, it is that instinct that you get that most people struggle with, again, especially in the ER where it's like, that's the big thing, like, are they sick? That has been huge for me. And then when I went into PA school, the physical exam findings, when they're teaching us, there's a physical exam class that we go through every semester for 3 semesters, for 3 hours a week, every week. We do physical exam findings. It was so easy. That was like, I aced that class so well because of my experience as a PA. It was not hard. And people who did not have scribe experience, a fifth of our class actually were scribes. A fifth of my 50 students were scribes. Actually, I think more than 50. We had 15 out of 50 students who were scribes. And they all aced the class with no problem. It was so much easier. And then prescription medications, again, may not know the pharmacology behind it, you may not know all of the physiology, but you know the drug. You know Rocephin is an antibiotic, or you hear all the stuff that they give in the ER. Again, this is only ER, but you hear all the stuff that they give, and again, you may not know it exactly, but when you go learn it from the pharmacology perspective in med school or PA school, you're like, oh yeah, they use that with this, they use that with pneumonia, they use that with UTIs, they use that with all of this stuff, and it is just having that basic underlying knowledge is just incredibly important.
Sarah was telling me something in Kathy's office too. She was like, being a scribe, I didn't have to take time to learn how to do the notes because I was practicing.
You start out so much further ahead of everybody else when you don't have to figure out how to write the subjective part or how to do physical exam findings. What's not only pertinent positive, so like, oh, they're tender here, or the lungs sound like this, or the heart sounds like this, but what is also pertinent negative? So they are not pale, so they're not anemic, so they're not this, they're not that. The pertinent negatives are also really, really, really important, and that's also what you want as a scribe. Like, make sure you put that in, that they aren't having any this, they aren't having this, and so that's also incredibly important. important. And then you also are just around other doctors. You're around other PAs, you're around other doctors who are talking to other doctors. So you learn how to present. They talk to people upstairs all the time. You learn how to present patients. You learn how to interact with fellow doctors. You learn how they teach residents. You get to sit around, especially if you're in a teaching hospital, you get to sit around while they are literally teaching them the entire pathophysiology of a person's medical problems. And it's like, so you're just sitting there listening, you are absorbing so much, even though you may not think you're learning, you are. Like, and then you go to day school, you're like, oh, I remember that patient, I remember that case, I remember that happening. I can now apply that to my knowledge in whole. So, yeah, it's great. It's awesome.
Letters of recommendation. I get so excited about all of this, guys. So, fun story. I went through like a, what do you want to call it, quarter life crisis like 2-3 years ago. It was great. Great.
Oh my.
I decided to last minute apply to med school in the Caribbean because I was like, this is what I'm going to do. And I got in. Yeah, so I can't remember if I called or texted this provider I've been working with in Jackson. Pretty consistently, after I got out of the year and started in family med, I worked with him for probably about 1.5 years straight before I accepted my first promotion to oversee the family med sites. And I texted him and I was like, so, I decided to apply to med school. Applications are due in like a week, and I need a letter of recommendation. And I'm going to California next week. So, here, could you, yeah. And he's like, yeah, I got you. Like, no worries. I'm like, okay, cool, thanks, I can help. So, I'm in California. I'm at dinner with a couple friends, and he texts me, and he's like, I finished the letter of rec, I emailed it to you, let me know what you think. And I'm like, you emailed me my med school letter of recommendation? Like, did I read it? Like, it was like the nicest thing ever. Like, it was great. Point being, you build awesome relationships with these providers. They're going to be able to write you much more personal letters of recommendation versus a template that a lot of them are going to use, saying like, yeah, so-and-so, she came to shadow me like twice, and yep, they asked great questions, and yeah. But they're actually going to be able to write a very individualized letter of recommendation, which is going to stand out to med schools. Did you ask any of the providers you speak with the letters of rec?
A lot of them will come to you and offer.
Yeah.
This is all they have to say.
Yeah, stand up and tell them.
So in the emergency room in Jackson, it's a teaching hospital, so there's tons of residents on top of all the providers. And like, I've had tons of residents approach me and be like, make sure when it's your time to go to medical school, you approach me and ask for a letter of recommendation. I'd be happy to write one for you. And even some PAs did, and a couple of the providers. So it's like, I can choose.
And you were able to ask at Sparrow as well, right? Yeah, and it's generally, it's a lot easier if you have that built relationship with them. I actually worked in Hemon last Monday, and she was a resident, and I met her once because the other Monday I happened to be working. She was there shadowing for like 3 hours, like that was it. And she walked in, and she really wants a Hemon fellowship or residency. I don't know which state. She wants to be a Hemon. I don't know what stage of the process she's in. But I essentially overheard the provider telling her, like, I want to get to know you more before I actually write you a letter of recommendation because you haven't been here that often. And they want to be able to do that. Like, they want to be able to actually recommend you because they know your skills, because they know your personality, because they feel like you're going to make a great provider or physician or researcher or whatever it is that you want to do. This will help you build those relationships. Like, they don't want to just write a letter of rec because you need a letter of rec and you're the one person that they kind of shadow for 3 hours. They actually, want to invest in someone who they feel is going to be able to help in that future. But you've also got great professors here. But medical people are great too. Throw the caveat out to your professors, but our providers are awesome. So, all right. Again, there's tons of opportunity for leadership as well. So if you're looking to take a gap year or two, like Chris has been doing, you don't have to just stay as a scribe. Like, you can do project management for a year. You can be a chief scribe for a year. You can do quality assurance for a year. It's really great opportunity and experience. And again, gets that leadership experience under your belt, gets that management experience under your belt before you go to med school, PA school, nursing school, professional school, whatever it is you want to do. I actually, this semester has been busier than last semester, definitely. But last semester I remember talking to a few friends and telling them, like, I mean, undergrad was great, but being a working professional taught me way more about managing my schedule than being an undergraduate student did. Dr. Baldwin agrees with me. So like jumping back into school was actually less difficult than I anticipated it being, because I knew how to keep a calendar and manage it. I knew when I could and could not do things. I learned how to balance that social life versus work life versus when I need to buckle down versus like I'm super stressed and I'm gonna go spend 2 hours at the gym because that's ultimately gonna make me more productive in the end. Taught me how to get a good sleep schedule. like being a working professional is going to help you know how to balance school, keep a strong mentality, but do well as well. And again, if you're not sure what you're doing, this is the perfect company to be in because we will help you grow. Lydia and I, we love to nurture people. We really do. And that's why we're in the positions we're in today. I didn't tell you this part, but we were on the phone the other day and I don't remember what you told me exactly. You were like, oh, she was like, I just love seeing people attain their dreams. And I was like, I had like all these things that like clicked in my mind. And I was like, that's why I do what I do. So I worked as a PA, not a physician assistant, a peer advisor, my sophomore year here at Spring Arbor. And I remember telling people, be like, if I could just be a PA for the rest of my life, I mean, that'd be great. Like, I love mentoring people, like, it's fine, whatever. And that's literally what I get to do now. And I think that's why I've really loved all the positions I've held with Scribe America, because I actively get to see people work towards their dreams every day. And that is the best feeling, knowing like I had a role in helping you accomplish that. Like when I was a chief scribe, I loved when my scribes got into med school. Like I loved when I had a trainee that did really well. When I was a quality assurance manager and overseeing a small team of managers, I loved seeing their successes with their teams. And now that I'm the hiring manager, I don't know, it's only been a week, but I am really excited. When I was a hiring associate across Southeast Michigan, it was really exciting to see the advances that we had made, more in numbers, so more in things like staffing and stabilizing our regions and things like that. But now I'm really excited to help mentor those people across the Midwest who are doing that for their regions and like see them stabilize those sites and see them be successful. I told Lydia this yesterday, the girl who, so when I started school, we trained my replacement to be a hiring associate, and she has been incredible. Like, she's doing amazing things. And I told Lydia, and I was like, sometimes I wonder if I trained her, or if, like, she just took over my job and did better. Like, I'm not really sure which one it is, because she's incredible, and I love seeing those successes. So, I actually want to jump to a little video quick. Does anyone else? Sarah, you have to look at your face. So we actually have 2 other alum in this video. So Spencer Carlson and Sage Trudell both graduated with us as well. Sorry, Chris, a little young. With us as well. Spencer, in this video, he was currently in nursing school, but he is now a practicing nurse at Beaumont Hospital. He did an accelerated program at MSU. And then Sage is in her 3rd semester of nursing school right now as well. And then Sarah, who you all have had a chance to meet.
Right now, I am actually back in school at Michigan State for their accelerated nursing program. I'll be done in just a couple months here. And that wasn't what I originally wanted to do, or what I thought I wanted to do. When I graduated and started as a scribe, I was pre-med and looking to get some experience to kind of bolster my med school application and help me decide if I really wanted to go that route. And working with the doctors, I had a chance to work with about 30 providers over the 2 years, and it slowly changed my perspective on what the provider role is, and sort of it opened my eyes to some of the clinical roles that are out there, and now I'm pretty sure I want to be in more of a hands-on role, like the down and dirty, like the day-to-day patient care, which is more of a nurse's role. For now, I'm excited to kind of take my clinical experience up a level and be interacting with patients.
Scribing gave me a huge leg up in nursing school. I went in with a foundation of a lot of medical terminology. My classmates called me the scribe master because I knew so much of the material already, and I was able to use that and not only help my classmates but be a little further along than a lot of my peers.
I felt like throughout the whole entire experience, especially that first year when you're doing some book learning, that the experience there helped me with medical terminology, it helped me with physical exam techniques, it helped me with knowing drug names, helped me with knowing how to talk to doctors during my second year, knowing how hospitals work, knowing kind of each role of each doctor and each PA and scribe and doctor and NP and nursing and just really pretty much everything. There was about 7 to 10 scribes in my class, and all of them felt that they had a leg up from being a scribe. I think it's really helped me particularly because I am working in the same department that I worked as a scribe, so I think that specifically helped me more than maybe just kind of a general experience as a scribe. I now know probably about 80% of my coworkers. I know how the hospital works. I know the EMR system, medical terminology, again, how to present patients to doctors, how to talk to my coworkers, how to kind of give orders in a respectful way, and how to write a good chart.
All right. Any questions? So all y'all can come up. Questions for any of us? It can be in general, it can be to a specific person. Yes.
For you, Jamie, what made you want to go to nursing school and health care?
Yeah, that is, I wish it was like a one-sentence answer. It was, for me, it was a bit of a long journey, especially because I wanted to be a physician for so long. My ultimate choices for the reason was more of kind of coming to terms with, I mean, I work hard, but I also don't do well if I don't have a social life. Like, I just don't. I kind of crash and burn. And that's what happened my junior year of school. So a lot of it was the work-life balance. A lot of it was wanting to be able, one of the things I thrive off of, one of the things I really enjoy is being able to be there for the people I love, so my friends and my family. And I really just didn't want to give that up for 4 years. Like even simple things like being in Sarah's wedding last, what was I don't remember when we got married in October. Sorry, Sarah.
Great bridesmaid.
I know. But like I'm in 3 weddings this year, and so it's nice to be able to do school and work and do that as well. But nursing is, there's also a lot of opportunity in the sense that you can kind of change career paths. So I'm a very gray person. Like some people are very black and white, and they're like, this is what I want to do, and they take that straight and narrow, and I'm like, ah, good for you. I wish I was that way. And I'm very like, but what about this? And what about this? And oh look, I'm good at that too. Like, and so with nursing, there's a lot more opportunity to be like, I can go to ICU, and if I don't like it, I can do outpatient. If I don't like it, I can change my mind. Like, I know. So there's a lot more opportunity to change with that, and it's less money.
You mean less cost, not less pay.
That's true. That's true. Less cost. Sarah knows all about that. So, yeah, it's definitely, it's like a very noodled journey, if you will, on my choice. Yeah, I hope that helped answer your question. Yes. I still think I'd make a great physician. This could just be another detour in my life, I'm not sure.
My mom, who is a physician, continuously tells her that she would make an amazing physician. And I'm sure other people do too.
Every day, it's great. You know, they really solidify my career choice.
So this would be really for all four of you. As a scribe, like physicians, you're privy to a tremendous amount of very personal information. And there's this elephant in the room, maybe that's not the right way to put it, called HIPAA, that you have to respect, or the elephant will trample you, legally speaking. Can you talk a little bit about HIPAA and just about the border between really being caring for patients on a personal level, but also just keeping your bloody mouth shut when you have to?
Yeah, so I think with the HIPAA question specifically, we are like any other member of the patient care team, we're held to the same standards. So whether it's a nurse communicating with the doctor about what's going on with the patient, the same communication that we would have with the doctor is the exact same standards that we were held to throughout. So it is really important. We have an entire classroom training session spent on what HIPAA is, why it's important, and how to avoid violating it. It's very easy to avoid, and people, we have some very horror story scenarios that we tell in classroom training about how when you make a dumb decision, it results in a lot of really bad things happening, to kind of hit home the importance of keeping that and making sure that your actions are responsible. And I think the big thing to remember that I push with every scribe that I work with is asking yourself the question, do I need to access this information, or do I need to have this conversation for my job? And if the answer is no, you better not access the information, because that is the violation. So, if that answers your question.
That's more on the professional level. Can any of you speak more to the personal level where, well, Sarah, sometimes you see patients, they're not conscious.
Right.
And you may never ever see them when they're awake.
Right.
Do you go up to the grocery in the grocery store and greet that person?
No.
Okay, now explain why.
HIPAA, I guess, is a privacy law, in case any of you guys don't know. So it's essentially that we, as any part of any patient care team, cannot share personal medical information of any patient or demographics. There's a lot of different levels to that, whether we can share if they are even in our hospital at all, if a family member is calling, we have to get their permission to do that, but sometimes they're not conscious. So there's a lot of gray areas when it comes to HIPAA, but we can't acknowledge that I have seen. So if I see a patient that I saw in the ER walking around, like you said, in the grocery store, I'm like, oh, and that honestly happens way more than you think it does. I've seen multiple patients out in public where it's like, and I usually remember, generally speaking, I'm pretty good with faces. I wouldn't necessarily remember names, but I'm good with faces. And once the face comes to me, I can kind of be like, oh, they were here for a headache, or they were here for whatever, and I can generally remember some things. And if I go up and say, hi, how is your child doing that I know you were pregnant with, 3 months ago that I saw you for, those kind of things, I cannot do that. Because that shares, whether it be anybody around that's listening, that shares that they were in the hospital for a medical reason. So I cannot even share that. But what we can do as providers is we can share stories, as long as we do not include any personal identifiers. I mean, other than, I guess, male or female. That would pretty much be the only personal identifier. Like, there was a guy in the ER the other day, and I can tell a story, but you cannot share any sort of age, a birth date, like where they were from, what their job was, I saw a senator the other day, you can't say that. But I did grow up, my mom is an ER doctor, and so I did grow up getting stories all of the time. So my mom was always very careful to never share any sort of personal information. So I think for me that has been overall pretty easy, but then that includes social media. Social media is a big one. Like real bad.
Avoid it.
Just do not ever post about a patient on social media ever. Doesn't even matter if you share any personal information, like it's bad. Because people know where you work. So just the basic information, if you're saying a guy in his 50s, blah, 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 came, oh, that was my, somebody comment, that was my dad, that you saw, it's like you just don't.
The best thing you can do working in the medical field is just not even talking about your job on social media.
Especially, on social media.
Like, even if you're like, it was a rough day, someone will attribute it to something.
Yeah.
Just don't.
It's inevitable when that happens.
It's hard, though.
It's inevitable when that happens, whether you share any patient identifiers or it's just a story or whatever, that I would get a call from the CEO of the hospital saying, wait, why did your scribe say this on social media? And then I have to have that very awkward conversation of, I don't know, we don't encourage that, let me fix this. So, yeah.
Before we take the next question, we've gotten real technological because we can't always read people's handwriting. So, if you are interested in more information, we would be happy to send you an email. Feel free to just fill out your name, email. If you want to leave your phone number, feel free. And then if you potentially be interested in printing your photos, you don't have to fill out the rest. I will pass out the laptop instead of a sheet of paper.
Wow.
So
Fancy.
But yeah, what other questions are out there? Yes.
So like while you're in undergrad, like how easy or difficult is it to do like scribing work as well?
Like as far as the balance? Or,
Yeah, like part-time, full-time.
It depends, I think, on your class load and your working schedule. For me, I definitely overdid it, like my junior year, and that's really kind of what turned me out. So I started working over the summer, which was definitely a great choice. I probably worked anywhere between 30 and 40 hours over the summer, and then dropped to part-time when I started school, but I was taking 18 credits that semester. And so I worked 2 to 3 10-hour shifts a week on top of the 18 credits. One of those classes was biochemistry with Dr. B. And it was just, it was not a good semester, I will say that much. My senior year, however, I was taking like 14 credits. I would do a day shift and then one night shift, and like I had my schedule down, and it was super manageable.
I think it was also helpful that you were in the ER. I think that's one thing because most classes, as you guys know, are in the day, and it's very hard to fit in a shift in the day unless you just do classes that day. But the ER, I think in that particular probably helps because you can do night shifts. You can really because ERs are open 24/7. You can really work with your schedule quite a bit more. I don't know if that is the experience, but I know I know that's the experience I worked out. If it's for you, being able to finagle things or not.
I mean, the finagling was easy because I could work nights, but it was just a matter of taking 18 credits and working 30 hours.
No, I'm just saying, So that might be helpful
but
for undergrad just because you can finagle that schedule.
How did you two find the balance though as well?
It was really hard at first, especially that first, like when you first get hired, you have to go through all the classroom training, and that was like my hardest class that semester, Scribe American. So, and then just getting used to like working night shifts or like evening shifts, so like going to class all morning and then going to, your evening shift, like it's out at 2 a.m. and then sleeping for like 6 hours maybe, and then going right back to class. That takes some getting used to, and it's hard work, but but that skill is valuable.
It's so valuable. It's manageable, but like we all get through it is the thing. Like we have a lot of students who work for us. I think except for Sarah, we were all students when we started, and so like it takes that time management, that balance, but it does. It's not doable. If that makes sense. I don't know if you want to. Lydia started during finals week. I thought she was crazy.
I started very close to finals week and finished shortly after, but I had a very atypical start with Scribe America compared to our normal classroom training process. We only had one class a week, where typically it's 2 or 3 classes a week, and then you start floor training in the first 3 or 4 weeks, but it was about 6 weeks after I was hired that I would start on the floor, and that was the week after finals, so it wasn't that crazy.
I totally pictured her going through all of it and going through finals at the same time. Literally, my mantra during classroom training was, if Lydia can do it, I can do it. That's what I did.
Yes. It is doable, and I think really what it comes down to is the time management that Jamie was talking about before, budgeting your time appropriately, and also prioritizing, making sure that you're making time for things that are important and that you deem are necessary for you to move towards the direction that you're looking for the rest of your life.
If you guys need to go, feel free. I don't know where the laptop is. If you want, maybe I should put it back in my notes. If you want to leave your email, if you don't have time, feel free. If you want to stay and ask questions, we'll be here. So if you need to leave, I get it. You got class, don't worry about it. But if you want to ask questions,